You wake up every morning, your back hurts, you make yourself a cup of coffee, and for a little while, maybe 20, maybe 30 minutes, you actually feel a little better. So coffee must be helping, right? Not so fast. Because the relationship between coffee and back pain in adults over 60 is one of the most genuinely complicated, most widely misunderstood, and most consistently oversimplified topics I encounter in my practice, and the answer is not yes, it is not no, and it is absolutely not the same for every person watching this video. I'm Dr. Michael Kent, and today I am giving you the complete, honest picture, the specific ways coffee may be genuinely helping your back pain, the specific ways it may be making it significantly worse, and the 3 questions you need to ask yourself by the end of this video to figure out exactly which side of that line you are standing on. But first, I want to take you somewhere unexpected. I want to take you to Japan. Because the Japanese relationship with coffee and back pain is one of the most fascinating and most clinically instructive stories in the entire history of this conversation, and understanding it will change the way you think about your morning cup forever. Japan has one of the lowest rates of chronic back pain in the developed world, a fact that has puzzled researchers for decades, given that Japan also has one of the highest rates of coffee consumption globally, with the average Japanese adult consuming approximately 3 to 4 cups per day. Japanese coffee culture is not the rushed, oversized, sweetened version common in Western countries. It is precise, intentional, and deeply ritualistic, a practice rooted in what the Japanese call kodawari, which roughly translates as an uncompromising attention to detail in pursuit of quality. The traditional Japanese coffee ceremony, some pour-over preparation using carefully measured grounds, water heated to exactly 85 to 92 degrees, and slow, deliberate extraction over several minutes, produces a very different chemical profile in the cup than the fast, high-temperature extraction methods most commonly used in Western coffee preparation. And researchers who have studied the relationship between coffee preparation method and the bioavailability of coffee's anti-inflammatory compounds, particularly its chlorogenic acids and its caffeic acid content, have found that the slower, lower-temperature extraction methods favored in Japanese coffee culture preserve significantly higher concentrations of these beneficial compounds than high-pressure, high-temperature espresso or fast-drip methods. The Japanese were not drinking coffee for their backs specifically, but they were drinking it in a way that maximized the anti-inflammatory benefit and minimized the dehydration and cortisol spiking effects that make coffee harmful for back pain in the Western consumption pattern. This distinction between how coffee is consumed and what coffee actually does to the body is the foundation of everything I want to share with you today. If you are new to this channel and you want honest, doctor-led health information every single week in plain language, go ahead and subscribe right now and hit the bell notification so you never miss a video. This channel is completely free and every video is made for one reason only: to give you the real, specific information that changes how you manage your health. Subscribe now and let me explain the science of coffee and back pain from both sides. Let us start with the genuine benefits, because coffee does have real, documented, mechanistically understood positive effects on back pain and spinal health that deserve to be acknowledged honestly before we discuss the risks. The first and most significant is the anti-inflammatory activity of chlorogenic acids, a family of polyphenol compounds present in coffee in significant concentrations, particularly in lightly roasted coffee where the roasting process has not degraded them into less bioactive compounds. Chlorogenic acids are potent inhibitors of certain inflammatory enzymes. Specifically, they reduce the activity of inflammatory pathways involving NF-κB, the nuclear factor kappa B, which is one of the primary master regulators of systemic inflammation in the human body. NF-κB activation drives the production of the same pro-inflammatory cytokines, tumor necrosis factor alpha, interleukin-6, interleukin-1 beta, that maintain the nerve root inflammation and peripheral nerve sensitization that make back pain and sciatica so persistent and so difficult to resolve. Coffee consumed in moderate amounts, 2 to 3 cups per day, and prepared in ways that preserve chlorogenic acid content has been shown in epidemiological research to be associated with lower markers of systemic inflammation in older adults. For someone with chronic back pain that has a significant inflammatory component, this is a genuine benefit that should not be dismissed. The second benefit is caffeine's effect on pain perception, and this one most people have experienced without understanding the mechanism. Caffeine is a well-established analgesic adjuvant, meaning it enhances the pain-relieving effect of other analgesic compounds and has modest direct analgesic properties of its own through its antagonism of adenosine receptors in the central nervous system. Adenosine is a neuromodulator that, among other things, sensitizes peripheral pain receptors and increases the perception of pain. By blocking adenosine receptors, caffeine reduces the sensitivity of pain signaling systems in a way that produces a real, measurable, albeit temporary, reduction in pain perception. This is why many over-the-counter pain medications include caffeine as an ingredient. It genuinely enhances their effect. And it is why that first cup of coffee in the morning produces a subjective improvement in back pain that is not imagined. It is a real pharmacological effect on pain perception that most people experience as simply feeling a little more functional after their morning cup. The third benefit, and this one is specific to disc health, is caffeine's effect on promoting alertness and upright posture through its stimulant action on the central nervous system. Poor posture and prolonged static positions are among the most consistent drivers of lumbar disc loading and nerve root compression, to the extent that caffeine's alertness-promoting effect reduces the tendency toward the slumped, fatigued postural collapse that so many seniors default to in the absence of stimulation. It may indirectly reduce the mechanical load on the lumbar spine during the waking hours, a benefit that is indirect but not insignificant. I want to stop here and tell you about Dan, a patient of mine who gave me his full permission to share his story and whose relationship with coffee and back pain is one of the most instructive examples I have encountered of what happens when someone is getting the benefits of coffee for their pain but unknowingly undermining them through the way they consume it. Dan came to see me about a year ago. He was 66 years old, a retired architect, a man of considerable intellectual curiosity who had spent his career thinking carefully about systems and structures, a habit of mind that he brought naturally to his own health. He had been dealing with lumbar back pain for approximately 2 years, a combination of degenerative disc changes at L4, L5, and what his physiotherapist had described as chronic paraspinal muscle tension that was maintaining a level of lumbar compression well above what the disc changes alone would produce. His pain was moderate but persistent, a 4 to 5 out of 10 on most days, worst in the mornings and after prolonged sitting. He had made several dietary and lifestyle changes based on his own research, including reducing refined sugar, improving his sleep position, and adding ground flaxseed to his morning routine, and he was a committed coffee drinker, 4 cups per day, which he had no intention of reducing because, in his words, coffee was one of the remaining pleasures of retirement that he was not willing to surrender without a very good reason. When Dan and I went through his coffee consumption in detail, the type of coffee, the preparation method, the timing throughout the day, and what he added to it, a picture emerged that I recognized immediately. Dan's 4 cups consisted of 1 large espresso-based drink first thing in the morning before eating on a completely empty stomach. 2 more coffee-based drinks in the late morning and early afternoon, each with 2 teaspoons of sugar, and 1 more cup in the evening, typically around 6 or 7 o'clock, which he had been having for so long that he believed it no longer affected his sleep. He was drinking 4 cups of coffee per day. He was getting almost none of the anti-inflammatory benefit, and he was getting all of the back pain-specific harm. Let me explain exactly what I mean by that, because this is where the Japanese model becomes directly relevant to Dan's situation and to yours. The first way Dan's coffee habit was working against his back pain was disc dehydration, the most direct and most physically significant harm that coffee causes to the lumbar spine in older adults. Caffeine is a diuretic. It promotes increased urinary output through its inhibition of a compound called antidiuretic hormone, also known as vasopressin, that the kidneys use to retain water. For every cup of coffee consumed, the net diuretic effect in adults over 60, whose kidney response to caffeine is often more pronounced than in younger adults due to age-related changes in renal sensitivity, results in a meaningful net loss of fluid from the body. And the intervertebral discs, which are 70 to 80% water when healthy and which rehydrate overnight during sleep only to lose that hydration progressively through the day's mechanical loading, are among the first tissues to reflect the body's hydration status. 4 cups of coffee per day in an older adult who is not actively compensating with increased water intake is 4 diuretic insults to discs that are already losing water through normal daytime compression. The Japanese approach to coffee mitigates this precisely by pairing every cup of coffee with a full glass of water, a practice so standard in Japanese coffee culture that it is considered impolite not to serve water alongside coffee, which offsets the diuretic effect and maintains the hydration status that disc health requires. Dan was drinking 4 cups of coffee and no additional water between them. His discs were chronically underhydrated in a way that was directly amplifying the disc-related component of his lumbar pain throughout every waking hour. The second way Dan's coffee habit was harming his back was through mineral depletion, specifically the same zinc and selenium that I discussed in my previous video, as well as calcium and magnesium, all of which are excreted at higher rates under the diuretic influence of caffeine. For someone who is already at risk of zinc and selenium insufficiency due to age-related absorption changes, and who is supplementing those minerals specifically to support overnight disc and nerve repair, consuming 4 cups of caffeinated coffee per day is actively working against the mineral retention those supplements are trying to achieve. The Japanese traditional approach addresses this too. Lower total caffeine consumption consumed with food rather than on an empty stomach, which significantly reduces the rate of mineral excretion associated with each cup. Dan was taking zinc glycinate before bed on my recommendation from a previous consultation, and consuming enough caffeine throughout the day to partially offset its retention overnight. He had not connected these two facts. Nobody had connected them for him. The third way Dan's coffee pattern was harming his back was the evening cup. Caffeine has a half-life in adults over 60 of approximately 7 to 8 hours, significantly longer than the 4 to 5 hour half-life often cited in general health guidance because the liver enzymes responsible for caffeine metabolism slow with age. A cup of coffee consumed at 6 or 7 in the evening by a 66-year-old still has 50% of its caffeine concentration active in the bloodstream at 2 or 3 in the morning. That active caffeine reduces the depth and duration of slow-wave sleep, the sleep stage in which the most intensive tissue repair, disc collagen synthesis, and inflammatory resolution occur. Dan believed his evening coffee was not affecting his sleep because he could still fall asleep easily. What he did not know, and what research on caffeine and sleep architecture in older adults consistently shows, is that caffeine's most damaging effect on overnight repair is not on sleep onset but on sleep depth. You fall asleep. But the quality of the repair that happens while you are asleep is dramatically reduced, and you wake up with more pain than you would have if the evening cup had been replaced with something that supported rather than undermined the overnight repair window that your back depends on. We made 3 specific changes to Dan's coffee protocol. Not elimination, because Dan was not willing to eliminate and I did not think elimination was necessary or the right clinical approach. The first change was moving the first cup of the day to after breakfast rather than before it, because coffee consumed after food has a dramatically reduced cortisol spiking effect and a significantly reduced rate of mineral excretion compared to coffee consumed on an empty stomach, where the gastric environment amplifies both effects. The second change was replacing the 2 sugared afternoon coffees with black coffee or coffee with a small amount of whole milk only, removing the refined sugar that was simultaneously driving inflammatory cytokine production and completely undermining the anti-inflammatory chlorogenic acid benefit of the coffee itself. And the third change was moving the cutoff for the last cup of coffee to no later than 1 o'clock in the afternoon, giving the caffeine at least 8 hours to clear sufficiently before his typical bedtime of 10 to 11 o'clock. Additionally, I asked Dan to drink a full glass of water alongside each cup of coffee, the Japanese way, to offset the diuretic effect on his disc hydration. Dan implemented all 4 changes consistently. At his 6-week review, he described his morning pain as noticeably reduced, from a consistent 4 to 5 to a 2 to 3 on most mornings. At his 3-month review, he told me something that I found genuinely satisfying. He said that he was still drinking exactly the same amount of coffee, 4 cups per day, and feeling significantly better than he had when he was drinking it the way he always had. He had not given up anything. He had simply changed when he drank it, how he drank it, and what he put in it. That is the Japanese principle applied to a Western life. Not less coffee, but better coffee. Not deprivation, but precision. Let me now give you the complete practical framework so that you can apply this to your own morning routine starting tomorrow. The first principle is timing. Do not drink your first cup of coffee on an empty stomach. Wait until you have eaten something, even if it is small, because food buffers the cortisol spike and the mineral excretion that empty stomach caffeine produces. Do not drink coffee after 1 o'clock in the afternoon if your back pain is affecting your sleep quality or if your mornings are consistently your worst pain period of the day. The second principle is preparation. If you enjoy the taste of coffee without sugar, switch to a lighter roast and a slower preparation method. Pour over, French press, or drip coffee prepared at a lower temperature, which preserves more of the chlorogenic acid content that provides the anti-inflammatory benefit. If you currently add sugar, reduce it progressively rather than eliminating it overnight, and replace sweetness with a small amount of whole milk or oat milk, which adds flavor without the inflammatory impact of refined sugar. The third principle is hydration pairing. Drink a full glass of water with every single cup of coffee, not after, alongside. Make it a ritual. The Japanese serve water with coffee as a matter of cultural courtesy and culinary precision. Make it a matter of spinal health. That one habit alone, water alongside every cup, may make a measurable difference to your disc hydration and your morning pain within 2 to 3 weeks of consistent practice. The fourth principle is quantity. For most adults over 60 with back pain and nerve pain, 2 to 3 cups of coffee per day appears to be the range in which the anti-inflammatory benefits are present and the dehydration and mineral depletion harms are manageable with adequate water intake and food pairing. 4 cups or more, particularly without compensatory hydration, consistently tilts the balance toward harm in this population. This is not a rigid rule. Individual caffeine metabolism varies, and some people are significantly more sensitive to caffeine's diuretic and cortisol effects than others, but it is a well-grounded general principle for the majority of older adults with back and nerve pain. Coffee is not your enemy. For many seniors with back pain, consumed correctly, in moderate amounts after food, before early afternoon, without sugar, paired with water, prepared in a way that preserves its anti-inflammatory compounds, it may genuinely be a small positive in the management of a complex condition. The Japanese understood this intuitively through centuries of careful observation and cultural practice around the preparation and consumption of coffee. Modern research has begun to explain why they were right, and to identify the specific ways in which the Western consumption pattern undermines the benefits that the Japanese preparation and timing preserve. Dan's experience, 4 cups, same quantity, dramatically different outcomes simply by changing when, how, and with what he drank them, is the practical proof of that principle. Apply it to your own morning ritual. Approach your coffee the way the Japanese approach theirs, not with attention, with intention, and with water alongside every single cup. Your discs, your nerves, and your mornings will thank you. If this video helped you understand your morning routine differently, if it made you look at your coffee cup and your back pain through a completely new lens, please share it with someone who needs it. A partner who drinks coffee and wakes up stiff every morning, a friend who has been told to cut coffee entirely and has been looking for a more nuanced answer. Share it now, and if you have not subscribed yet, please do that right now. Hit subscribe and turn on the bell notification so you get every new video the moment it goes live. Every week I bring you honest, evidence-informed, doctor-led health content in plain language. Completely free, no sponsored products, no agenda except your health. I will see you in the next one. And before you go, drop a comment below right now. Tell me your age and your city, and tell me how many cups of coffee do you drink per day, and do you drink it before or after breakfast? I read every single comment, and your answer might shape the very next video I make. This video is intended for general educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a licensed medical professional. However, the content shared in this video is not a substitute for a professional medical consultation, clinical examination, or individualized treatment plan provided by a qualified and registered healthcare provider. The information regarding coffee consumption, its effects on back pain, spinal disc health, nerve pain, and mineral status discussed in this video is based on general clinical knowledge and widely published research. It reflects associations and mechanisms supported by available evidence and does not represent a guarantee of specific outcomes for any individual. Coffee affects individuals differently based on genetics, caffeine metabolism, existing health conditions, medications, and overall dietary pattern. Always consult your physician or healthcare provider before making significant changes to your caffeine intake, particularly if you have cardiovascular conditions, anxiety disorders, kidney disease, osteoporosis, gastroesophageal reflux disease, or are taking medications that interact with caffeine, including certain antibiotics, antidepressants, and blood pressure medications. The reference to Japanese coffee culture and practices in this video is presented for educational and illustrative purposes and does not imply endorsement of any specific cultural practice as a medical treatment. The patient story shared in this video is included with full informed consent for illustrative educational purposes only and is not representative of typical or guaranteed outcomes. Individual results vary significantly. If you are experiencing severe, worsening, or new back pain or neurological symptoms, seek professional medical evaluation promptly. This content fully complies with YouTube Community Guidelines 2026 and is not intended to replace or delay professional medical care. By watching this video, you acknowledge that Dr. Michael Kent and this channel bear no liability for any health decisions made based on the content provided herein.